Namaste, this is Dr. Surya Kanta Pradhan, consultant ENT head and neck surgery, Apollo Hospitals, Bhubaneswar. Today we'll be discussing about thyroid swellings or thyroid tumors. Thyroid swelling and tumor is very common, and the prevalence is around 8 to 10% in common population, and it affects mainly female patients as compared to males, and the most common age group is 20 to 50 years, and it increases with age. It happens mainly in the thyroid gland. Thyroid gland is basically a butterfly-shaped gland which is present in anterior part of the neck. It secretes thyroxine hormone, and this hormone is very essential for different functions of our body. These tumors develop in this gland, and the different risk factors for this disease are like, say, iodine deficiency in our food, and if the patient is irradiated for some other cancers, and some of the tumors runs in family, and there are genetic factors. These kind of patients present to us with various complaints like swelling in a neck which moves with degglutination. Most of the time it's painless. Some patients present to us with difficulty in swallowing, difficulty in breathing, and hoarseness of voice. When a patient comes to us with these kind of symptoms, we clinically evaluate the patient. After taking history, we examine the patient, which part of the gland is affected, what is the consistency of the tumor, whether it is soft, firm or hard, and we have to evaluate the voice of the patient, whether the voice is normal or it is low. After the clinical evaluation, we advise some basic investigations like thyroid function test, ultrasonography of neck, and fine needle aspiration cytology. Sometimes CT scan of neck and radioiodine scan is also advised. In thyroid function test, we get to know the status of thyroid hormone and how the gland is functioning. In ultrasonography of neck, we confirm the size of the tumor, which part of the gland is affected, whether there are any other nodules in the neck, and any metastatic node in the neck. And in FNAC, we remove small amount of fluid from the thyroid tissue and we examine under microscope. In this test, we get to know whether the swelling is benign or malignant or cancerous. After all the investigations, we confirm the diagnosis, and if the patient is having a diffuse swelling or diffuse tumor with hormone level below the normal standard level, then we offer medical treatment, and we give the patient thyroxine replacement, and the swelling subsides and the patient improves. But if the swelling is a benign or malignant kind of tumor, one part of the gland is affected and the hormones are normal, then we offer surgical treatment. In surgical treatment, we remove the tumor along with that lobe of the gland. This surgery is called hemithyroidectomy. It is mainly done for benign thyroid tumors, and if we remove whole gland, we call it total thyroidectomy, and it is done mainly for cancers. And in hemithyroidectomy surgery, we remove the tumor along with that part of the gland, and now we are using microscope for this thyroid surgery. We can magnify the field up to 40 times, and we can save and preserve vital structures like our vocal cord nerve and parathyroid gland, which are very useful for our functions. And now by using microscope, we can save vital structures, and the complication rate in these surgeries is very less, and the patient can be discharged on the same day or next day. This surgery is very safe. Now if you have any queries regarding thyroid surgery, you can contact us.